So this week's Ask Dr. Durie comes from a questioner who wants to know, do small steps really represent significant progress? And this is actually a very important question, and it stems from the observation from a trial that was presented in the fall last year in 2018, in which elotuzumab, the monoclonal antibody elotuzumab, was combined with pomalidomide and dexamethasone and compared with pomalidomide and dexamethasone in the treatment of patients with relapsed myeloma. And what this gentleman comments on is that there was an improvement in the length of the remission, what we call PFS, by 5.6 months. And so obviously he was commenting that we would like to see more of a benefit for a new drug. And so I think the answer to that is obviously yes, we would indeed like to see that. But I think there are some very, very important points which are raised by this question. First of all, it is difficult to conduct trials, and oftentimes in the trial that ends up being done, such as in this case, the benefit may seem to be relatively small, but it is a statistical benefit which is sufficient for acceptance of a new combination. In this case, the combination was also well tolerated, which is quite important. And it is really important to keep in mind that 5.6 months is 5.6 months, which can be very, very important for a patient who needs some therapy as a bridge to something that may give more prolonged benefit. And so it is something that's important. We would like to have it be longer, and often it is longer when a combination like ELO, POM, DEX is used in an earlier disease setting. But a backdrop to this question is, aren't we really looking for some treatment that would be more dramatically beneficial? And I think that particularly for the International Myeloma Foundation and for our Black Swan Research Initiative, we definitely are. And so we are looking for therapies that are more definitively effective, that would produce more prolonged benefit, and maybe be part of a combination to try to achieve cure. And so the bottom line is that every benefit is definitely helpful, and certainly for some patients who really need 5 or 6 months to get to have a remission and maybe a better therapy for the future. And we would love to see therapies that achieve even more dramatic benefit. But each combination, each new drug as part of a combination is an important step forward, and we must be really clear about that this is something that we do appreciate, and everything makes some true benefit.